Assalamu alaikum my YouTube family, hope you all are doing well. So today I am going to teach you the anatomy of the external ear, which is ear is the important topic of our ENT subject, in which we study the ear, nose and throat. So first of all we are starting from the ear, and basically there are the three parts of the ear. Ear is divided into three parts: external ear, middle ear and internal ear. So we are starting from the external ear. Basically external ear includes the two parts: ear auricle and ear pinna. Ear auricle and ear pinna is the same thing. And external auditory canal. So it also include the tympanic membrane, which is known as the eardrum. Now first of all, if we are going to talking about the ear auricle or pinna, so basically ear auricle is made up of the yellow elastic cartilage, and basically the main function of the external auricle or pinna is to collect the sound waves and transmit it to the external auditory canal. And the other important thing regarding pinna is that the cartilage is used in different graft surgeries. The important point, the surgical point regarding the pinna is that its cartilage is used in the graft surgeries. Like elsewhere in the body we need the cartilage, so we take the cartilage from the pinna, just like in the saddle nose surgery, in which the cartilage of the nose drops down, so we take the cartilage from the pinna. So the yellow elastic cartilage from the pinna is used as a graft for different regions of our body. Now I took the book of ENT Shruti Ningra for the reference of this picture, the clear picture of the pinna. I already told you that pinna is made up of the yellow elastic cartilage, except its lobule, which is the devoid of the cartilage. Its whole part is made up of the cartilage, and there is also a second point where there is the absence of the cartilage, that is devoid of the cartilage, and this is known as the incisura terminalis. Now what is the importance of the incisura terminalis? Importance of this incisura terminalis is that through which we can enter into surgery without damaging the cartilage of the ear. So here you can have the clear look of the ear pinna. This is the spine of helix, this is helix, and this is concha and tail of helix. This is antitragus and tragus. The most important thing you can remember here is incisura terminalis. This part is devoid of the cartilage. So as I already told you that our ear is divided into three parts: external ear, middle ear, internal ear. So in the external ear we have the ear auricle pinna, external auditory canal and tympanic membrane, which is also known as the eardrum. So we have covered the pinna, and now we are going to. So here I have the clear diagram of the external auditory canal. For examination point of view and OSP, you should definitely know the diagram of the external auditory canal, the ear, the middle ear and internal ear, because these things can come in your OSCE examinations. So this is the auricle, and now from here the cartilaginous part of the ear is continuous with the external acoustic canal or external auditory canal. Basically this canal is divided into two parts. The outer one third, the outer one third, this which is the cartilaginous part, and inner two-third is the bony part. The outer cartilaginous part is 8 millimeter, and the remaining is this which is 16 millimeter of the bony part. So total the length of the tympanic membrane will be 24 of the millimeter. So this is the external auditory canal. Now the most important thing, that at the end of the bony canal there is the tympanic membrane, and the difference between the cartilaginous part and the bony part is that cartilaginous and bony part are not straightly lined. Like this one is slightly upward and this one is slightly downward, so actually it forms a shape like this. Means that this tube is not a straight tube. So that's why during the external auditory canal examination we are going to pull the pinna upward, backward and laterally to clearly see the tympanic membrane. And in our cartilaginous part, there are the different things like the ceruminous glands, the sebaceous glands, and hairs. Now, the ceruminous gland produces the wax. Wax is the golden brownish material which is protective. Actually, it protects the tympanic membrane, that the different insects, the foreign body, does not reach the tympanic membrane. So the fruncle, the boils only occur in the cartilaginous point, a cartilaginous part, because it is the infection of the hair follicles, and our hair follicles are present in the external cartilaginous part of the external auditory canal. And in the bony part, where the cartilaginous and bony part form, they form a constriction. Here it is not shown that there is a constriction which is known as the isthmus. The importance of isthmus is that the foreign body lodges here, and it is very difficult to remove that foreign body from the isthmus. What is isthmus? Isthmus is a constriction between the cartilaginous and bony part of the ear. So last but not the least is the tympanic membrane. Tympanic membrane is also known as the eardrum, where our ossicles hit and produce the sound vibrations. So I am going to teach you how to make an eardrum diagram. Before learning tympanic membrane, we must know that how to draw the tympanic membrane, because this is really important regarding your examination point of view. So first of all, you draw a circle, and because our tympanic membrane is not a circle type, it is oval in shape and pearly white in color. So there will be two folds in it, the anterior malleolar fold and the posterior malleolar fold. So it comes like downward, and here it is the in the middle between it, in the middle part there is the major concavity that is known as the umbo. Now this is the diagram here I form is the umbo, and in last we are going to do the labeling, and here it is the like head of the malleus bone, the pressurized here, and it forms a indentation. So this is the anterior malleolar fold, posterior malleolar fold, and here it is the pars flaccida. There are the two parts of the tympanic membrane, pars flaccida, which is also known as sharpnel membrane, and pars tensa. And here is the annular ring, which is the fibrocartilaginous ring, which is actually the thickening, of the pars tensa part of the pars tensa part. This is the pars tensa, and this here there is the thickening, and which forms the annular ring. And at the anterior-inferior portion of the tympanic membrane there is the cone of the light. Now this is here is the cone of light. Now this is here is the umbo. This is the anterior malleolar fold and posterior malleolar fold, and the pars tensa, which is also pars flaccida, which is also known as the Sharpnel's membrane, and this is the pars tensa, and this is the annular ring. Now this is the diagram of the book Shruti Dingra, in which we can see that this is the sharp nail membrane. Nail membrane is the another name of the pars flaccida. Basically, the pars flaccida and pars tensa are the two parts of the eardrum. Why it is known as pars flaccida means it is not that much taut, it is flaccid, because the fibrous layer, there are the three layers of the membrane of the tympanic membrane, and these three layers are the these three layers are the outer epithelial layer, inner mucosal layer, and middle fibrous layer. And this fibrous layer, now here I am going to tell you about what is the difference between the pars tensa and pars flaccida of the tympanic membrane. Actually, these two are the parts of the tympanic membrane, and whole tympanic membrane has three layers: outer epithelial layer, inner mucosal layer, middle fibrous layer. So this is the outer covering, this is the innermost, and this one is the middle fibrous layer. Now this fibrous layer makes the difference between the pars tensa and pars flaccida, because this fibrous layer is arranged into radial, circular, and parabolic in the pars tensa part. Now this whole is the pars tensa part, and this upper part is the flaccida part. So basically these layers are not like arranged into the pars flaccida part, so that's why we are calling it pars flaccida. So this layer is thin because the fibrous layer is not organized into various layers like it is organized into pars tensa into radial, circular, and parabolic forms. Now little bit more information further about the eardrum. Eardrum is obliquely lined. It is pearly white in color, 9 to 10 millimeter wide, 9 to 10 millimeter tall. So basically it connects the external acoustic canal and the middle ear. What is the function of the eardrum? Here you can see, clearly appreciate the three tiniest ossicles in our body: malleus, incus, and stapes. So basically the malleus is hitting here, and it will produce the vibrations. Which are going to transmit it into the with the help of ossicles into our inner ear. So this is for the today. In this we discuss about the external ear. So in last I am going to summarize that what we have studied in today's video. So in today's video we have studied about the ear, the anatomy of the ear. So I first of all tell you, ear is the organ of the hearing, through which we hear, through which we sense our environment. It is one of the sense of the organ, it is one of the sense of the hearing, which is only possible due to ear. Ear is basically three parts, which is divided into external ear, middle ear, internal ear, and in today's video we have studied the external ear. External ear is further divided into ear auricular pinna, external auditory canal, and tympanic membrane, which is also known as eardrum. So I told you about ear auricle, that it is made up of the yellow elastic cartilage, and the important point is incisura terminalis. It is devoid of cartilage. We can go through surgery through this route. And another important point regarding auricle, that we can use this cartilage for the cosmetic surgery, for the saddle nose surgery, and other cartilage graft. And then I told you about the external auditory canal, the two parts of external auditory canal, the outer cartilaginous part, so we are here on the outer cartilaginous and inner cartilaginous part, the two parts. And the importance of the outer cartilaginous part is the furuncle and boil infection only occur in the cartilaginous part, because hairs are present in the outer cartilaginous part, not on the bony part. So furuncle and boil infection occur here. And in the last we studied the most important thing in our ear is the tympanic membrane or eardrum, the anatomy of the tympanic membrane. So these are all parts we have discussed in the tympanic membrane. Now this is the cone of the light, the anterior inferior part. Now in the viva teacher can ask you, what is the cone of light? So your answer will be, sir, it is the reflection of the light which is formed on the anterior inferior part of our eardrum. So it is basically just a reflection of the light. And teacher can show you, if you sometime you draw a diagram of the tympanic membrane, teacher can ask you that of which ear you have drawn the tympanic membrane. So from this cone of light we can identify that this is the tympanic membrane of the right side. Here it is written at the landmark of the normal tympanic membrane of the right side. If it is of the left side, the cone of light will be formed over here. So this way we can identify that this tympanic membrane is of right ear and this tympanic membrane is of left ear. So thanks for watching. Please subscribe to my YouTube channel and support me, and wait for the next video in which we are going to study about the middle ear. Bye bye. Thank you.